The following educational program is intended as a supplement to Broviac care teaching done by your nurse or physician. It is not intended to replace one-on-one teaching individualized for your child. Should you have any questions or concerns about Broviac care, please contact your child's physician. Across the country, caregivers are taught different methods for recommended Broviac care. This video demonstrates only one of these methods. If information contained in this video conflicts with what you have been taught, consult your child's physician. Understanding the Broviac catheter, knowing how it works, and especially how to care for it, is essential to your child's healing process. So let's take a look at how it works. The Broviac catheter is a lifeline. It's inserted directly into your child's bloodstream. It's a quick and easy way for your child to receive medicines, blood products, and nutritional fluids. It also allows for the withdrawing of blood samples for testing. In addition, it spares the most, though not all, painful needle pokes. To keep the catheter operating properly, it's filled with a solution that contains heparin and antibiotics. Heparin is a medication that keeps the blood from clotting and plugging the catheter. Antibiotics aid in preventing infection of the catheter. So that's how it works. Now it's your job to take care of it. Once a week, you'll change the dressing that covers the exit site. This is where the Broviac comes out of the skin. Daily, you will flush the catheter with the heparin and antibiotic solution. And weekly, you will change the end caps. This is Misty Longcore and John Rickert and their daughter, Brittany. Brittany has had a Broviac for 6 months. In the beginning, they felt a bit overwhelmed by the responsibility of caring for it.
First time we had to change Brittany's dressing without any doctors or nurses there to help us. So we were nervous and afraid we were going to do something wrong, afraid that we weren't going to get that sterile technique just right. But I started doing it, and it, didn't seem too bad. It was kind of, getting a little bit easier the more we did it. It just seemed like first time I did it, it took me forever. Now I do it in 2 minutes, and it's easy as can be.
Before you start, it's very important to understand what's meant by the terms sterile technique and sterile field. Sterile technique means taking special precautions to prevent the introduction of germs or bacteria. And a sterile field is nothing more than a work area that is sterile or free from germs or bacteria. It is difficult to maintain a sterile technique and sterile field, but the goal is to be as sterile as possible. If you have any questions regarding sterile technique or sterile field, don't hesitate to call the clinic.
The hospital had suggested that we set up a routine for Brittany for her dressing changes and for the flushing of her lines. And I choose to do her dressing change at night and to flush her lines in the morning. That's just what's more convenient for me to do. She's really good about it. She knows when it's time to flush her lines in the morning, and she knows when it's time to do her dressing change at night, and she's really good about it.